Hey, Dr. Tracey Gaslin, welcome to our Tick Boot Camp podcast.
Thank you. It's fabulous to be here.
So you are a really interesting person, I have to say, because not only are you a doctor and you are treating patients, but you're also the Alliance for Camp Health CEO. And as part of that, you are the Fight the Bite program lead as part of the Alliance for Camp Health. So we're going to get into more details about that later. But if you can, just give us a quick summary about what you do on the day to day as a doctor and also in your role as the CEO and program lead of Alliance for Camp Health and Fight the Bite.
Well, I'm fortunate, Matt, because I say I am lucky enough to get up every day and do work that I love to do, and that is getting to interact with people and educate and teach. So, as a nurse practitioner, I get to take care of patients every day and get to kind of walk along the life path with them. And then, as the CEO for the Alliance for Camp Health, I get to be a kid. I get to go to camp. I get to hang out with people who really understand what camp does and the service it provides. If you've not been a camp person, you don't always understand the emphasis and the power that that experience holds. You may think, hey, yeah, we get to play some archery or we get to go swimming, but really, we know camp is so much richer than that, and there's such value and benefit that there's no other experience like it. So we love camp. We love what it does for youth and for staff and for so many people. And that's why people keep coming back year after year. We say people live the other 51 weeks of the year, so week 52, they get to go back to camp.
I love that.
Yeah.
So, what about the Fight the Bite, though? That's sort of like a subset of the Alliance for Camp Health, right? And I'm assuming it's regarding a tick bite and protecting campers from the risks of a tick bite.
For sure. Fight the Bite is a program that is a partnership between the Alliance for Camp Health and SC Johnson, and they have done amazing work coming alongside us and supporting our efforts as we do an extensive reach out to try to connect with camps and partners, raising awareness, providing education, offering resources to help with tick bite prevention and, of course, Lyme disease. We started our first year as a pilot project with 13 camps in Wisconsin, and we launched that to kind of make sure we had everything in operational rigor. And then this year we're doing a Midwest expansion. So we have about 60 camps, 67, I think, actually, that are enrolled in the program for our Midwest effort. And those camps are doing education with their staff. They're doing education with families and care providers. We're going to be reaching out to pediatricians here at the AAP conference this fall. So the Midwest expansion is really rolling along, and we're collecting data and doing research around tick bites, tick encounters, and what prevention activities people are doing in the camp and the natural summer space. Because we know, right, most ticks happen between April and September. We do know there are more ticks in more counties, in more spaces and places. My last conversation with the Center for Disease Control said, hey, that we have identified ticks in every county in the country. And so it
That's
just makes
wild.
him, yeah, it's wild, isn't it? So you often thought it was New England, or you thought it was the Northeast or Midwest. But what we know, there are ticks in every county in the country.
So, what you're doing through the Alliance for Camp Health and Fight the Bite, is that mostly a Western United States program or is it across the whole US?
It'll be nationwide next year. So year three is nationwide. And so we went from a pilot project to a Midwest expansion this year, where we have about 10 states this year in the program. And then next year it will be across the country. So we're excited to kind of expand national next year and bring in all of our resources that we've been working on, all the tools, the education, and just kind of continue to build out and enjoy the partnership with SC Johnson, who are just great at helping us create magic at camp. The magic at camp about keeping people healthy and safe.
Well, I don't think this is a coincidence, right? There's no such thing as a coincidence because we are right now here in New York. I am involved in and my family works at a lot of camps locally. So we got to talk offline for next year because I think there's a lot we can do to link you up and maybe partner together in a couple of things. So you mentioned that you are looking for data and analytics and things like that. I don't know if you're familiar with LymeDisease.org and Lorraine Johnson and all the great people over there at LymeDisease.org, but they have the My Lyme data, which is basically pure data to provide information to people. So I think that's a great resource, and we can link you up offline if you'd like to kind of maybe partner together to get some of the data they have, some of the data you have, and kind of bring it together into one super powerful data engine to
For
benefit
sure.
the Lyme community. So again, that's I think that's a great resource. The other one is we've been recently in touch with one of our earlier guests from probably 4.5 years ago is Dr. Nancy Fox and Cassidy Colbert from the Leaf Foundation, Lyme Education and Awareness Foundation. Are you familiar with them?
I've heard of them. I don't know them personally, of course.
Yeah, well, they're actually right now. Dr. Fox just left New York. I think it was 2 days ago, Tuesday,
Mhm.
and she's a teacher. And in the summer, she travels around and goes to camps and will provide tick education and Lyme education to all camps throughout the Northeast of the United
Oh,
States.
nice.
So I think you guys would make a cool partnership because she's just a passionate, caring person working for a not-for-profit, raising awareness, and she could be a great collaborator as well. So if we can help
Sure.
link you up with the Leaf Foundation and Dr. Fox or limes.org, we'd love to help you kind of continue to power your engine and expand the scope of your initiative.
We think collaboration is the name of the game. So how we partner and coordinate with people is really important. So we love the idea anytime we can come alongside other people and say, how do we build a robust engine? You're right. The engine is key, and the power to kind of really get the word out there and engage people in a way that it's important to them. It's not just here's another card with some educational information. No, this is really important. And how do we begin to help them understand that? So we don't want them to have a tick bite to get in the game. We want them to be able to do really good prevention activity and work. And camps across the US serve about 26 million youth in the summer. When you think about 26 million youth, you have to think about how many healthcare providers you also need, which is a large number, which means a robust rollout of education and training and preparation. So we are always ready to go when it comes to connecting with large numbers of people and populations because we're firm believers in kids being outdoors too. The value of nature and engagement is so important. And the research has validated that over and over. But how do we keep you safe while you're engaging in the natural world?
Yeah, we have over 500 published podcast episodes that we have transcriptions from. And as we're speaking, I'm thinking so many of our guests told us that they were bit by a tick at a young age at a summer camp and didn't get properly diagnosed until much later on in life. And they share those stories. So if that can be helpful as well, we can provide you with those particular examples and even give you those transcripts if that's helpful to spread awareness and also just partner and advocate.
Oh, absolutely. Yeah. The more people that are speaking, the better we are, right?
Yeah.
Team is good.
So before we're going to come back to this, so I just want to
Okay.
give some context. Who are you? Who is Dr. Tracey Gaslin, and why are you doing today what you're doing? Right, because you have to be very passionate when you get into the Lyme world, and almost everybody we speak to has such a drive and a selfless approach to helping other people. So, what brought you here? Tell us about what your life was like as a child and how you evolved into this excellent version of yourself today to give back to the community.
Oh, that's funny, Matt, because my story is probably a little contradictory to what I do. As a child, I went to camp, and I would say it was the worst experience ever because I was a kid and I went to Girl Scout camp and I couldn't get my fishing badge. And here I am in my 50s and I still remember that. So I tell people, was your camp the thing as a child that empowered you to go back to camp? I'm like, no, no, it did not. But then I got older and I was became a nurse and I was working and a friend came up and said, "Hey, would you go to camp with me? I need some help taking care of kids." And I was like, sure, I don't know what I'm getting into, but sure, I can come help you. I was a pediatric nurse for many years, and so we went to camp, and I got to the camp facility, and within that 1 week, I was out in nature with youth, and we did activities, and we canoed, and I said, okay, wait a minute, this experience here is a really unique opportunity to make an impact just in this week, this immersive, nature-based opportunity where kids learn problem solving, critical thinking, build community, establish belonging, all those skills we want to have as adults. And I said, oh my goodness, this space is truly magical in that way and all the things it does for youth. And that was in 1996. And I haven't missed a year of camp since that time. And every year between then and now, I've kind of I kept adding weeks. So first I was going to camp for kids with bleeding disorders. And then it was camp with bleeding disorders, and then another week with oncology. And then it was bleeding disorders for a week, oncology for a week, and asthma for a week. And I, long story short, said I would just love to be at camp year round. That would be amazing. And in my state, they built a new facility for children with special needs. And they came to my school where I was teaching. I was teaching at the university for about 10 years, and they came and said, "We want to talk to your students." Of course, I started asking questions. Who are you? And who's your medical director? And what do you do? And who are you serving? And 3 weeks later, I had left my university job and moved to be the medical director at the special needs camp for 6 years, year round, and did that and loved it. Loved the ability to impact families as well as youth. Um, and did that and loved it, and then went on from there, became involved in my professional organization, the Alliance for Camp Health, served on the board, and just kind of kept coming through the ranks. And they said, "You need to serve as the CEO." And I said, "No, no, I don't. I'm just loving camp, loving what we're doing, and meeting people where they are in their time of need, and in a way that's felt very therapeutic to me, to be in the natural space and the breeze and the activities." And then here I am. I've been doing the CEO role for 11 years almost now. So it's just been such a gift. It's a gift to be doing what we do every day.
All right, so I'm going to recap that a little bit. So you were working as a nurse. A friend pulled you back into the camp world. You realized that this was a beautiful space that you love spending your time in to help give back. And then you stopped being a nurse and you became a full-time medical director for camps. Is that correct?
Yeah, and I was still a nurse, but I mean, I served as their medical director there because as a nurse practitioner, I was able to perform all the functions they need in that role. So I was able to kind of write prescriptions and take care of patients and diagnose things in the camp space. So I served as medical director for 6 years, and then just decided, okay, I'm going to do this and see how it goes.
No, have you ever had
camp? I still go to camp. Like I still have my week of camp at least every year, a week or two every summer. I have to get out, be with kids, enjoy the space, engage in really kind of youthful, fun ways that keeps us young. They keep me young.
Have you ever had Lyme or a tick-borne disease?
I have been bitten by a tick. I've had bullseye rash, and I just treated early and was very lucky that I haven't ever had, quote, significant Lyme disease.
Yep. We say chronic Lyme, as controversial as it may be, or post-treatment Lyme disease, whatever you want to call it, right? I mean, long-term Lyme, long Lyme, whatever, all the same thing as far as we're concerned here. So you caught it early enough. You had a tick bite. You got a bullseye rash. You treated with doxy, probably a short course of doxy, and thankfully you never got beyond the acute stage. So now, I just want to make sure I have full context of this. So you're working at a camp. And after the 6 years, did you pivot away and did you go back to doing something else? That's where I was a little fuzzy. What happened after that 6 year window?
So after 6 years, I was traveling quite a bit between my home and the camp where I was. And my poor husband didn't see me very often. And I said, I need to be home more. And so I kind of left and still worked with them on the side, kind of a few weeks out of the summer, and then came back home and just started working as a nurse practitioner again full time. And I work now currently in the bleeding disorder space. So I take care of individuals with hemophilia and platelet disorders. And I get to go to camp with them in the summer. So I take all of my patients to camp in the summer, and we have a great time, and we learn and we grow and we figure out how to navigate life and build a support system and a network. So these kids who start going to camp together when they're 6 are still best friends when they're 15 and 20, and they have lifelong friendships that bloom out of camp. So I love it that we get to offer them that, if nothing else, that particular opportunity.
So when you say you're a nurse practitioner treating people with bleeding disorders, is that at a hospital, a facility? Give us a little more information about what that looks like for you.
Yeah, so I work in Louisville, Kentucky at a University of Louisville. And so we have a clinic called the Hemophilia Treatment Center. And that's where I do my clinical work as a nurse practitioner. And so it's in an outpatient clinic, and I take care of all the patients with benign bleeding disorders.
And what when it comes, is it all pediatric, meaning all kids, or is it a mixed range of ages?
I am fortunate. I get to be lifespan. So I take care of you from the time you're born to the time you pass away. So I love that I get to have a gentleman who's 80 in the room next door to a new baby. And those people see each other and they connect and they share advice and they share stories. And it's just a beautiful experience for me because I love the whole lifespan. I love patients who come in and they're fresh and they're new and they're fearful. And I can connect them with people who are walking the walk and have been doing it for several years, and now they've got a whole new support system and a understanding of the condition and how you navigate life and all the pieces that go into making people really feel confident and comfortable.
Yeah, another disconnect I have in my head is, so, I people that go into hospitals for bleeding disorders or particular conditions or diseases, I've never heard of, and maybe it's just me, but I've never heard of, like, okay, we have a group of people with a particular similar disorder and they're going to go to summer camp together, right? So how did that happen? Did you make that happen because of your background, or was it something that was already there when you took this job to serve these people?
Yeah, no, most places in the country, there's about 140 hemophilia treatment centers in the country, and most all of us have a camp associated with our work. So we work very hard to build community. Bleeding disorders is rare. So when you have a rare disease state, that means that person doesn't meet anybody like them hardly ever, maybe never in their lifetime. So coming to a hemophilia treatment center gives you connections through we have a foundation that works with us that provides education and resources. We bring families together all the time in an effort to build community. We all know that the number one thing that helps us prolong longevity is a support system. And so how do we do that in this space? And so the HTCs, and I've been going to hemophilia camp since 1996. So it's one of those things where I can't imagine not going. It's just part of our DNA, right? To be at camp and to build that community and bring in new people, the new ones that come in every year, and those that kind of age out and go into becoming counselors and doing other things. So it's just a really true life cycle approach to care. And to me, that's just the beauty and joy of what I get to do.
Did you intentionally get involved in bleeding disorder nursing and you're providing medical services because you knew they had a camp and that kind of bled together, or kind of blended together your two passions in life?
I was no. No,
It was
see,
a happy coincidence.
a happy coincidence. It's amazing because I would never be here doing what I'm doing today if it wasn't for bleeding disorders. So I think it's interesting that you say that because I've done a little bit of everything in the kind of the pediatric space and women's health space. And then I was a NICU nurse and I was working in the neonatal intensive care. And that's when the nurse asked me if I wanted to go to camp. She said, I need somebody to go to camp to help me give kids their medications. And you're pretty good sticking kids with an IV. And I said, I'm in. Let's do it. I have no idea what hemophilia is. I don't know what a bleeding disorder is, but if you're telling me I get to start an IV on somebody, I'm your girl. And so I went that first year of hemophilia camp, and then the space just captured me. And then the population, I started doing some home health work, and I was going into these kids' homes that have bleeding disorders and providing their medication. So I've been able to kind of engage with this particular bleeding disorder population in all sorts of ways. So I was going into their homes, I was going to camp with them. I started teaching about benign bleeding disorders when I was at the university teaching. And then this role that I sit in right now at the Hemophilia Treatment Center came open, and they were like, we need you to come take care of bleeding disorders because nobody knows bleeding disorders. And I'm like, what? And so it is rare. And so nobody knows. And so I spend a lot of time working with other practitioners, other providers, surgeons, dentists to say, here's what we need to do to make sure this patient doesn't bleed too much. And here's the kind of care we need to be thinking about providing. So,
I mean, you definitely have a unique background, and you're very specialized. Being a dual certified pediatric and family nurse practitioner, you have your PhD in educational and organizational leadership. And then you just shared that you were also teaching, right? You were teaching courses for other medical professionals. I do want to circle back to that, but I have so many questions for you. Another question I have is, how the heck did you get involved in tick bites and Lyme disease? Because it's like a really cool, fun, like summer camp. I'm in a specialized medical world with bleeding, bleeding disorders. But where does tick bites and Lyme disease and co-infections kind of play into your world now?
Education's always kind of been my passion. Most people say they like administration or education. They kind of go down one of those two tracks as a general rule. But I've really always liked education, and that's why I went into teaching for about 10 years. And then when I became involved with my professional organization, the Alliance for Camp Health, there was all kinds of opportunities to begin to teach and write and instruct around camp topics that were important for us to understand. So whether it was concussions, uh, flora and fauna like ticks and mosquitoes and poison ivy and poison oak, all those things that as a traditional nurse you don't encounter in your practice. Most nurses are working in hospital or acute care settings, so they're not dealing with kids falling and hitting their head on a rock. They're not dealing with snake bites. They're not dealing with ticks and mosquitoes and poison ivy and poison oak and all these kind of community-based topics. And so I really enjoyed the fact that we're bringing normal lived experiences and bringing health and wellness education to those experiences. I also love educating community probably more than just individuals. So when I can get a community of people together, it's kind of like going to a concert, right? You go to a concert and you can act a little crazy because you're in the community of other people who are acting a little crazy at concert. We do the same thing at camp.
Yep.
If you were at home, you would not dance like you dance at a concert. You wouldn't, just wouldn't be normal. It would seem odd and out of place. And with camp, we can do songs and dance and chats and all kinds of things that build community that we would never really do on our own. And so this ability to come together and teach and educate around, hey, we're going to learn about ticks. I'm going to do that because we're going to play tick baseball.
What is that? What do you mean tick baseball? Tell us
We
more.
make games. Everything is a game, right? We don't just have people sit and write on a chalkboard and hand them out a lesson like we do in school. Everything is immersive. Everything at campus. How are we going to teach this in a really fun way? Or how are we going to let the kids teach it? Or how are we going to engage them in learning about their health condition? Or how are you going to know if this is poison ivy or poison oak? How are we going to do that? We're going to get people magnifying glasses and we're going to go out in the woods. We're going to see if we can find the smallest tick with our magnifying glass. We do all kinds of things to engage with the natural world. So it's not just we're in it, we're learning about it and from it and through it. And kids love that and they remember it and take it home with them.
So before we get into more about the teaching by having fun and using a game method, I just want to talk about still how Lyme was on your mind to even be part of your curriculum of education. So it wasn't because you had campers that were constantly being bit by ticks and infected that you realized we have to educate our campers and their families about the risks of tick-borne diseases? Like, how'd you even know you had to do that? Do you know what I mean?
Yeah, well, it was pretty common knowledge that if you're going to be in the natural world setting, there's going to be exposure to ticks. And so we knew that. We knew that's just part of being in a natural environment. What are those things we have to be thinking about? And ticks obviously is one of the things right near the top of our list. What do we need to do to be prepared? If we're preparing for camp, what are those things we're going to mark off our preparation list to do? Do you think anybody goes to camp without appropriate bug spray? No, that would be crazy. You would never go to camp.
But so people, I would guess some people do. Is it not true that some campers come unprepared and you have to properly guide them, or am I mistaken in that assumption?
We're pushing really hard, right, Matt, to make sure people are not coming unprepared. And then camps are key. Camps will have insect repellent available because there's always going to be a few who don't bring those resources that they need. But we feel like if you're telling me historically, you feel like there were people who probably didn't. I feel like we've come a long way.
Mm.
Because now, I mean, when I get to go visit camps and I do visits to camps, I'm seeing their sunscreen and their bug spray containers. I mean, they're full, right?
Huh.
To make sure we're doing really good sunscreen protection, really good insect repellent protection, and that we're using that before we go out into our natural environments. So I love that. I mean, that says, yes, we're headed in the right direction where people are listening.
That's great to hear. I think it's good. It's good that we're better prepared, but it's also a sign that maybe tick-borne disease is on the rise, which is why people are more aware. So I think it's good and bad, right? More people are getting sick and infected, probably. But as a result, maybe we're better prepared for these types of outdoor adventures. Now, what are you doing as part of your education and preparations? Like even at a camp, forget about your curriculum while the campers are there. What kind of information are you sending out to the parents and the kids to say, come prepared with, obviously you mentioned sunscreen and insect repellent. but are you guiding them to do other things like light colored socks, tuck your socks, and like what's on your to-do list or action item list for your campers to stay safe and prevent themselves from being bitten by a tick?
Yeah. We do a lot of things in the prevention focused pre-camp effort. So pre-camp, uh, camps do a lot of work around sending information to the family ahead of time and then asking the family, we want you to talk with your child about each one of these things every night for the first 2 weeks leading up to camp. And one night might be about, okay, we're going to talk about ticks tonight. We're going to talk about tick prevention. So we want to make sure, what are we going to pack in our suitcase? And we really ask the family, the parent, to engage the child in that conversation so they bring voice to that experience. So now the child has ownership of that to say, oh, I'm responsible. I brought my long pants. I have my closed-toed shoes for horseback riding. I have my long pants for the hike. And so we really try very hard to kind of make sure we give families a preparatory resource tool, kind of fun and engaging, almost like a game that says, hey, what are we going to do to prepare for camp, prepare for ticks? We know there's going to be ticks there. What is that going to look like? And then we'd like to also encourage and send out pictures of the camp and the facility that shows here's where we have play equipment. Here's where areas are that we stay away from, where ticks are more likely in the, the shaded, moist, hot areas. We're going to put this is why we have our play equipment in the sunny area, because ticks like the darker areas better. We're going to put it out here in the sun and the heat because ticks don't like that as well. So we help camps and families think about what the camp layout looks like and why things are the way they are at camp. This is why we have the gravel path. We want you to stay on the path, right? So we do a lot of this preparatory education about the facility itself, what the facility is doing, and then what the family's role and involvement is, that they can help do good prevention of ticks by educating and working with their youth before they get to us. Did you pack your insect repellent? Do you have your long pants? What we talk about tucking our pants in our socks? All the different pieces that are really important. And then it's helpful to families for them to see a picture of the camp anyway, because it helps decrease homesickness and the other things that we work through as well. So all those pieces kind of come together in this way of kind of bringing family and camper into this agreement, if you will, of how we're going to work together to stay healthy at camp. We include hydration in there. We include sunscreen in there. We include adequate sleep, all those pieces. And ticks are just a really important part of that.
So from doing all these podcasts and speaking to everybody in the community, we've developed two frameworks at Tick Boot Camp. One of them is called ACRE, which is the prevention side of Lyme disease, and that's avoid, check, remove, and early intervention from a tick bite, right? So avoid ticks, check for ticks, properly removing a tick, and intervening early if there's a tick bite to ensure you don't become unwell and chronically ill like many of us with this post-treatment Lyme disease syndrome. Now, we've been building this out and we're constantly updating it based on crowdsourced information and guests like yourself, which is why I'm asking you, like, hey, what's actually on your checklist? Because we want to integrate that into our framework and share that with you. So maybe it can help shed some new ideas to your educational material as well that you share. So what else specifically is on your literature that you send home before camp, and also what you teach kids in camp, in addition to, okay, maybe light colored clothing, tuck your pants into your socks, right? What else on there is a good tip to protect yourself from being bitten by a tick, right? The avoid side of it. How do you avoid a tick? And then also how do you prevent a tick from biting you, right?
Right. We work so closely with the Center for Disease Control, right? So much of our work, all of our documentation, all of our program has been kind of reviewed and vetted with them, which has been super helpful to make sure we're kind of meeting some of the national guidelines and information. And so within that, we have all the things that are those really important prevention strategies that are outlined, the individual prevention strategies and also the facility kind of prevention strategies. And they kind of course, intertwine as well. So the things we've mentioned so far, the preparatory things about bringing insect repellent and bringing the right type of clothing and knowing how to kind of navigate the space. We also do things like long sleeves. We do daily tick checks. That's just kind of part of who we are. It becomes part of it. It's one of the camp activities. Here's Camp Activity 101, tick checks. Taking showers after we've been outside, really talking about and making sure youth feel comfortable coming to their counselor if they find a tick. we make everything as immersive as possible. So when we're talking about ticks, sometimes we do show them how small they are, like the nymphal ticks and how tiny they are, and they need to be looking for the really small things and areas that they're irritated that maybe they can't see. They may need somebody else to look at for them. So tick checks become a really important thing for us on a daily basis at camps, typically right after they've been in some outdoor space. And then we do spend a good deal of time helping camps figure out their logistical facility layout. What does that look like? What are the things you should consider doing in order to help minimize ticks getting into the play spaces? It's never going to be perfect, but you know, we don't want to attract rodents to the cabins. So what do we not do? We don't bring food into our cabins.
Yep. Yep.
You know, so it's an extended kind of approach because no parent's thinking about, oh, you should bring food into their cabin. Well, we do because we check kids' suitcases to make sure there's not food because we know food brings in pests and animals and bugs, and they also can harbor ticks. And now
Yep.
we've got a whole nother sequence of events we have to think about. So all of the facility things, we try to help them say, here's things to think about and consider as you plan and set up your facility structure just from a tick perspective. How do we keep in the deer at bay?
Yeah, it's multifaceted. I'm glad
Yeah.
you're touching on a lot of things that we've had in our mind and in our framework already. So it's very nice to hear a lot of these things. Now, and it's interesting because it's been in the news a lot, I think the last 3 weeks or so, where it's been, Pleasure Beach in Bridgeport, Connecticut. The beach is shut down for the entire season for 2025 because of a tick infestation. So it's been all over the news here in the Northeast. I've never heard of a beach being shut down for the season because of a tick infestation, right? And that's happening. So as we continue to, move on and ticks continue to expand their scope of where they live, it's becoming more and more of a risk. So these skills are needed for everybody. And frankly, I didn't even know what a tick was or understand what Lyme disease was until I got sick. So I'm happy to hear there's people like you out there that are doing this. But as a follow-up question to that, obviously you mentioned that you're a nurse practitioner, you have patients, you treat people with bleeding disorders, and now you also in the summertime you help administer the camp for those people that you help, serve medically. But that's in your one capacity. In your other capacity, you're also, the CEO for the Alliance for Camp Health, which is more of a next year going to be a nationwide thing. And that right now it's more of a Midwest thing. So what does it look like? How do you scale this for all of these different camps? Because, you're pretty busy, right? You have to deal with your camp. You have to deal with your full-time job of serving these patients. How do you have a team of people at the Alliance for Camp Health who basically disseminate and push this information out for campers to be safe? Like, how does that work,
Oh, you hit on the challenges of life, right? The logistics of making things work smoothly. But we are very fortunate in the camp space that most camp healthcare providers do it out of passion. They are not doing it for the money. Because you're not making money by being a camp provider or camp professional. But so we have lots of people who are very passionate about what we're doing and why we're doing it and come alongside us in really amazing ways. This year we have organized it so we have tick nurse leaders. And so every tick nurse leader who's been a nurse, camp nurse for many years is now overseeing a group of camps, a group of 10 to 12 or 15 camps, and came alongside those camps as we were coming into summer, made sure they had all their education for their staff in place, all the education for families and campers available to them going out, all of their tick resources, all of their transition of care kits, everything that they would need. This one person was kind of their point of contact and continues to be throughout the summer to help them navigate the space, get answers to questions. And then I run a health hotline every summer. So camps can reach out to us at any time and they call me. Like I said, I was on the phone with somebody today about a tick issue, and we talk through it and we share guidelines and recommendations and help them navigate where they are in the process. So many people, many joyful people joining hands and getting the work done is how we do a lot of what we do.
So literally you have a dedicated nurse to be assigned to a dozen camps in a particular area to go provide the education and get ahead of it before the camp starts to educate the staff running the camp. And then you're scaling that with multiple people to oversee groupings of camps. And then you have a hotline for almost like phone a friend emergency. Is that, and then I'm just trying to
I am the
simplify
phone a
it.
friend. Yes, I'm the phone a friend for sure.
So tell us how you got. So obviously, the fight the bite is this initiative through the ACH,
Hmm.
but you have SC Johnson and Johnson, or SC Johnson, I guess is what it's called now, right?
Uh-huh.
As a big sponsor to help you grow and expand. So how did you get that to happen, and how did you start this program? Because we know running not for profits is the ACH a not for profit? It looks like it's a .org,
It
so you
is.
are a
We
not
are
for
not
profit, right?
we're not for profit, right?
So it's very difficult to grow not-for-profits and get big sponsors like that. So how could you do this? And I mean, look, we're in New York and we found you over there in, the Midwest. So you're clearly doing a good job with your outreach. But tell us how you've been able to be successful and grow.
I have to give all credit to SC Johnson because they reached out to us and engaged us and started asking questions and saying they wanted to, because they're very much a family friendly, focused on communities and health and wellness, from water safety to, tick prevention to serving things even from a global capacity. So they have been just phenomenal in coming alongside us, working with us and saying we need to do this because they recognize that there is a real need for tick education and prevention. So SC Johnson has been a amazing partner through all of this work and continues to be just a stalwart in making sure people are getting the resources they need, support they need. So we are just so thankful for their engagement in this opportunity. So the credit goes to them. We are just the hands and the feet, and we have the connections and the people that we work with day in and day out through camps across the U.S. So it was just a really nice fit for the two of us and felt like this was a good way to move the initiative forward, get more information disseminated, and really try to meet a need in the space of tick prevention.
So tell us about what you do, because we touched on the avoiding ticks and how to prepare. But when you find a camper who is bit by a tick or had a tick and ripped it off or has a tick biting them, what do you train these camps to do in that moment? Because that's kind of like the next level, right? Okay, these are all the things you should do to prevent a tick from biting you, which we talked
Right.
about pretty, thoroughly. Okay, but next you find a tick that actually is biting you. What kind of steps do you have there? Because I want to kind of morph, what you guys have and we have to kind of provide good education in that area. When you actually find a tick biting, what's the right thing to do?
For sure. So if we find an attached tick, the first thing, of course, is to get that tick removed as quickly as possible. So most camps have either trained all their staff or most of their staff to effectively remove a tick. How do you remove a tick? And we train them on, pulling the tick straight up away from the skin. We talk about all the things you don't use. We're not going to put petroleum jelly on it. We're not going to light a match.
Don't
We're
burn
not going to
it.
do we're not going to do all these other things. This is the one way we're going to remove ticks. And so we teach that. And of course, we try to get an estimation of time, and we talk about signs and symptoms, and then the healthcare staff at the camp then take over. We have a transition of care document that we fill out. So the front has information about the tick bite, about how to remove the tick, about the steps, the signs and symptoms. And then the back of the form is a diagram of a person, and we outline for the parent where the tick was found. We circle on the body where that is. We write on there what treatment we did for the kiddo while they were at camp, whether they got a dose of doxy or whatever that might have been. And then that goes home with the parent. And then the parent then has all the information from camp about the care we provided. And we say, your child could develop a rash, right? We give them instructions. We give parents instructions to say your child could still develop a rash 3 to 30 days after the tick bite. If your child has any symptoms or concerns, please take this document to your pediatrician or primary care so they continue to follow your child in a very timely way. So we really built on a transition of care model that we know, because of that window of time, that if you only have a kid for a week, even if the kid got bit on the first day of the week, you need to be able to provide education and training to families and their home care providers to know that this kid was bit with a tick and this is what we did and this is where it was on the body, and make sure we have the best communication we can sending those youth home.
That is amazing, because we've had people on this podcast tell us either they themselves as a child or their child, if it's the parent, were bit by a tick in camp, and the camp never told them. They didn't even know. The child told them, right? Or they got really poor communication from the camp. So it's really good to hear that this is what you guys are pushing out there for camps across the US starting next summer, because
Yeah.
we really need that. And I think it's amazing that you guys even take, proactive treatment. So you're removing the tick and possibly even giving them some sort of topical
Yeah,
and maybe even oral antibiotic on site. Is that true? As through
that is
your
correct.
that's
Yeah.
wild. That's
So
excellent.
the PEP, post-exposure prophylaxis. So if you feel like the tick has been attached more than 24 hours or, to whatever your concern is, the child arrived with a tick and you found it 2 days into camp, you want to be navigating those pieces. There's conversations that happen. There's prescribers that understand that and talk through that. But if most camps will keep a dose or two of doxy on hand. It's not expensive. So keep a dose of doxy or two on hand. And if a kid has a tick bite and they meet the PEP requirements, like they're in a high endemic area, the tick's been attached for a certain period of time, all the variables, you walk through the algorithm and you say, yes, this kid meets all these parameters, they get a dose of doxycycline. Um,
It sounds like you have a ton of literature, like what you send home, what you send to the parents before they come to camp to get ready. Then you have this guide of what to do if you find a tick biting the child. Can you is that something you can share and we
oh,
can put on?
absolutely.
Because what I'd love to do is put that in the show notes of this podcast, so people listening can just click on the links and see all the information you have as far as preventative that goes home to the parents, educational content, and also like a boilerplate example of, hey, this is what we sent home if a kid is bit by a tick. Because that information can be super helpful, or just for parents
Sure.
listening to be able to digest and download and give them a little bit of peace of mind. And, I guess the question is, if somebody's listening and they have kids or a family member or whatever in camp, and they want you to partner up with their camp to educate them, can they reach out through your website to say, hey,
Absolutely.
I live
Yeah,
in
absolutely.
Pennsylvania, I live in North Carolina, I want you to call my camp and teach them what you just taught on Tick Boot Camp. They can do that through the allianceforcamphealth.org website, right?
You're exactly right. And we have a whole tick and Lyme disease page, and there's all types of resources and tools and videos. So we have training courses. We have 2 training courses there, for one for health staff on camp and one for healthcare providers at camp. And so next year we'll probably do a little piece for families and campers. But we wanted to make sure we got staff and healthcare provider training on board. So as people are coming into the camp in summer, they take their course, they get their certificate showing they've been trained, they've met all the requirements, and then they come into camp and hand me their certificate if I'm the nurse at camp. And now I know my staff has received all their training for tick prevention. We can then practice some things. We can talk about how you remove a tick effectively. And then we talk about all the pieces of moving forward after that and how we communicate with families well at the end. So we have really tried to bring it full process, right? From before kids arrive at our door all the way through the camp experience, whether it's a week or 2 weeks or all summer, to getting that information and education back home to families. And so that thing we call transition of care is really important to us.
Wow. So I'm looking, I didn't even see the section of your website. So under the education tab, you have a lot of courses. Some of them are paid courses that are more advanced, but you also have Becoming a Fight the Bite Camp, Learning Tick Bite Prevention and Care, which is free. It's a whole course. And then you
Yep.
have a Fight the Bite Tick Education for Camp Healthcare Providers, another free course, which is excellent. So I mean, they can just share this with their camp and then reach out to you guys for more partnerships or collaborations there. Wow, this is wonderful.
So it'll be all the information and courses are free. And so the goal is, even if you aren't, quote, in the Fight the Bite program in the Midwest this year, you can still use the resources for free. We're just basically not collecting data from that group. We're collecting data and research information from the Midwest camps this summer.
Got it. So the follow-up question I have is, do you do any follow-up with your campers that are bit by ticks? And I think this is going to be very difficult, right? Because how do you track that to know, hey, we had 25 kids that were bit in this 4-week camp? How many of them, ended up getting sick, had an infection? I think it seems like once the kids leave the camp, it's hard for you to really track data on them, right?
It is. And I mean, we don't even know who the kids are, right? Because we're just the national nonprofit educational organization. We don't even know how many kids, often, other than the camps we're working with, we don't know how many kids were bitten at camps at the other camps. So we encourage people to the best of their ability to reach out to families, a week, 2 weeks, a month after the kid's been home, just to say, tell us what they said about their camp experience. Did they have any health issues after they got home? We encourage the camps to really do some type of post-camp follow-up. Many of them do post-camp surveys around their experience and what that looked like. And some of them do a really nice job of including questions about any health concerns when the kiddo got home, or any questions around things that they felt like they didn't get information about. So camps, we really try to gather data because those camps that are gathering data are making improvements all the time. And I always tell families, if a camp is asking you to fill out a survey, do it, because that means those are camps that are invested in change, invested in improvement, and they want to make a difference and make the experience safe and healthy for your child. So
one of the hard things that we've experienced at Tick Boot Camp is that there's a spectrum of people. Some of them are very much, hey, I don't care, give me the strong chemicals, because I'd rather have some chemical exposure through like a permethrin or a DEET, right? And that's acceptable to me, understanding there might be risk there. And others are like, heck no, I want the natural stuff, give me the essential oils, which, and I don't really know for sure, but some people say maybe less effective than the chemicals. So how do you broach that with your educational material? Because, oftentimes we can rub people the wrong way or turn them off to us as an organization or not for profit in your case, if we're pushing one too strongly. So how do you bridge that when there's such two strong sides there to natural versus chemical?
So our recommendation, sometimes I laugh and say it's kind of like immunizations. We recommend that every child is fully immunized to the best of their ability for camp, period. It's what the American Academy of Pediatrics recommends. It's what we recommend because we know there's a resurgence of measles, and it's because people are not immunized. When it comes to insect repellent, we recommend EPA-approved repellents that have gone through testing, that have gone through rigorous kind of evaluation, and to use those products are the ones we know are the best that we know of today at preventing tick bites. And so we don't have data on the other things. On the essential oils, maybe not enough data to make a decision. So we really say we're following the recommendation for EPA-approved repellents. And here's a list of them. And any of these that you think that you're comfortable with, we would encourage you to use on a regular basis during your camp experience.
So is there an instance you can think of where a camper got sick under, I don't want to say your watch, but at a camp that you were engaged in and ended up being Lyme disease? Because I'm just thinking, if you can share that story just so people can be on the lookout for what their child may be experiencing if they get sick from Lyme at a camp, just to be aware of those particular types of symptoms and reactions in a child.
I get calls on the hotline around this kid's been bitten by a tick. We followed the post-exposure prophylaxis. We gave a dose of doxycycline preventatively. I don't know that I have definitive data to say this kid absolutely developed Lyme disease, and I'm sure there were some that did. I'm sure there were some kids who developed early Lyme disease. What I would love to be able to say is that nobody developed disseminated or late stage. That's the goal. That's the goal. But I mean, the whole idea is that early awareness, early recognition. So we start, as I've said before, we start with that kind of talking about it before they come to camp. Here's ticks. And here's things we want to look for. And if you didn't come to camp with a rash, but you develop a rash at camp, we want to know about that. It could be contact dermatitis for all we know, but it's okay. We want people to recognize, how did I come into was I in a healthy state when I arrived at camp? And then did any of that change during my experience? And if so, letting us know. So I'm sure, I feel pretty confident to say there probably were some people who got Lyme disease, and I'm very hopeful that they were recognized and treated quickly and early, and that our efforts, yours and mine and many others, will continue to make that a situation where the number of people with late stage goes down. Even if early stage goes up, I would like to see long-term disseminated cases go down.
Yep, that for sure. So I'm just kind of want to brag for you a little bit. I mean, you've trained over 3,500 seasonal camp staff. You're right, in the short time you've been doing this. You've reached over 25,000 children. You have over 40 plus pediatric providers. And, from, I think it was last year, you had 8 Midwest states, or maybe that's this year, but you're expanding this year. Okay. So you're expanding to all states next year. And that's really impressive. So a lot of what I think we need to do is we got to get you connected with some of these Lyme orgs, because if you guys partner up with some of these bigger, international Lyme orgs, ILADS, right? International Lyme and Associated Disease Society, Global Lyme Alliance, Project Lyme Alliance, some of these ones that, have a lot of influence and we want to help facilitate that. I really think you can really put this initiative to the next level. And I do want to come back to that, but the other thing I don't want to lose sight of that I've had in my mind for a little bit now is you said earlier that you taught, right? Or you teach. So do you teach at a college, and what area do you teach, and to whom are you teaching?
Yeah, I taught for about 10 years at the university and taught all pediatric content, all taught a lot of pathophysiology and taught a lot of leadership. So I was fortunate to get to teach a lot of different areas, but I was teaching nursing students and loved it, loved the whole area of teaching. And I love to take students into community-based settings for their experiences. So while I was teaching, they had the flood in Louisiana. I forgot what year that was, but I took students, about 10 students, and we hopped in cars over Christmas break and went down and we worked in Louisiana following the floods to help rebuild homes and help people there. And it's the one thing those students remember forever about their nursing experience. Remember when we went to Louisiana and we put roofs on houses and we helped do construction and clean things out. And I said, and remember, in those moments, you weren't using a stethoscope, but you were nursing to people. You were nursing people back to health. And whether you were swinging a hammer or doing whatever it was, you were nursing people while you were there. And I said, don't lose sight of what nursing care looks like. And so I love that. And I feel like I get the opportunity to do that educational stuff in this camp setting all the time. And so kids will be walking across camp and you'll see them kind of buddy up. And I'll say to somebody, and I'll say, watch that right there. See what's happening right there. That is what's making a difference in their life. Right there. See those community agreements, see those engagements. That's making a difference. See them all spraying their repellent on and their sunscreen and taking big drinks of water and playing their water games. So you got to drink water faster than everybody else because whoever puts their cup on their head first is the winner of the game. So everything's a game, everything's engaging, immersive. And I love to kind of have that creative venue to do the education, to say, okay, if I'm going to teach somebody about ticks, how are we going to do that? And it's going to be fun. What does it look like? We've done it 10 different ways. And so it's just fun to have people say, I remember when we drew tick pictures on the cups and we had to turn them upside down and we had to hunt for different things. Yes. So fun ways to do immersive education and training is really probably my highest passion.
So two follow-up questions to that. The first one is, when you were in school to become a nurse, how much of your curriculum, if any, was based off of tick-borne illness and Lyme disease? Because we've had people come on and say, I'm a naturopathic doctor, I'm a medical doctor, I'm a nurse, I'm a chiropractor, I'm a this, I'm a that. And I got minimal at best, and in some cases, none when it comes to tick-borne disease education and Lyme education. So what was your experience like in your academic side of your life before you became a nurse practitioner? And was Lyme ever taught?
If it was so marginal, I don't even remember it. So if it was a passing glance on a page in a textbook. It was not anything that got attention that it was important enough to spend time on, unfortunately. So yeah,
So what are
very
your
much in the same
thoughts?
boat.
Not to get too controversial, but what are your thoughts about the varying approaches to diagnosing and treating Lyme disease, right? Because some people say that a one dose prophylactic of doxycycline is good. Some people say it's not. We've had a lot of leading researchers and doctors on this podcast that specialize in Lyme and tick-borne disease. Some of them argue that a one dose, prophylactic of doxy is effective after a tick bite. Others argue it's actually harmful because it can make things worse by maybe suppressing symptoms and then allowing it to lie dormant and unnoticed and come out later on in life after a physical trauma, a car accident, things like that. So have you experienced any of the controversial parts or the political parts of Lyme, and has it made your job harder to educate and train people because some things we just don't know enough about yet, and there aren't enough research studies around them, and people are so strongly viewed and positioned in these areas?
Yeah, great point, Matt. I will say that I'm in no way in the boat with all of those experts and what their understanding is physiologically around the impact of treating with doxy or not. So I don't say that I have expertise to lend to that kind of thought process. I will say I've always been very fortunate to kind of be on the prevention, education, teaching side, and I love that space. And my hope is that I get to send fewer and fewer people back to these experts to say, I need you to take care of them for their disseminated disease. Um, we just tend to follow the guidelines, right? So, and sometimes you say you got to do more than just give as directed. Some people say, I just did what the Bible says, and the Bible says give as directed. I'm like, sometimes you got to think beyond that. And I realize that, and I appreciate there are experts who have the knowledge and expertise to think about that in very different ways. And I know that they're going to continue to lead the way in thinking about how do we treat tick-borne illness continuing down the road. So I don't know that I have a strong answer in that area other than to say we want to just continue to be good prevention advocates and teaching and education and doing whatever guidance is put out there. And when new guidance comes out, we're fully on board.
Yep.
We're harnessing that, and we want to use that in the best way. And that we all know that because of research and trials, that all changes. And that's the beauty of where we sit.
Dr. Gaslin, I love that answer because all of us in this community are helping advance the Lyme and tick-borne disease community in different areas, right? So you're hitting it hard from one angle. We have researchers hitting it from another angle, practicing doctors, that specialize in Lyme in another angle. So it's all of us together just constantly pressing in that are going to allow us to have a better future for our kids, right? Let's be real. Yeah. So, I do want to share with you, though, to kind of build upon what you said, and I shared a little bit offline with you about this, why what you're doing is so important. Because knowledge is power. And I think one of the hard things that I had to realize in my personal Lyme journey is before getting sick, you think you go to the doctor tells you what to do and what's wrong with you, and you're going to get better. And you're going to get better within a couple of days. You're really sick. Maybe it'll be a week, right? But you don't realize that sometimes doctors don't have the answer. And sometimes doctors are humans and they're flawed and they have the best of intentions, right? But without proper knowledge and proper awareness and prevention tips that you're sharing, it can be absolutely devastating. So just this week, one of my close friends reached out and her mother was in the hospital. She was in the hospital with her mom. Her mom had a high fever. She had, serious leg pain, was nauseous, was delirious, and she had a tick bite about 6 weeks ago. So she knows about tick boot camp. She knows because I'm an advocate at work, in my personal life, in my you name it, professional life. Right? Everybody knows who I am and what I do. So they go, I think this might be a tick-borne disease, and the doctors don't know what's wrong with my mom. My friend says to me. So I go, all right, it sounds like it's something, right? 6 weeks after a tick bite, you're probably gonna, ask for a full tick-borne disease panel. She's at a hospital where in Long Island, New York, where tick endemic, tick infested, Long Island, New York. So she had to ask for the tick-borne disease panel. She had to tell them about the tick bite. She had to spoon feed it. They do the tests, and they say, you know what? It's going to take about a week, and which is crazy. They send the labs out. Take about a week for us to get the full Western blot. So we're just going to give you one dose of doxycycline and send you home, and you should be fine. Now, that's not enough at this point, right? She has she has something clearly, and maybe it's not a tick-borne disease. So fast forward the next day, she's home and she's getting worse. So they send her home and she's calling me going, what do I do? So I go, look, to me, it's black and white. 6 weeks later, a tick bite. These are classic tick-borne disease symptoms. I really think so. And if anybody's listening from Long Island, she was at Brookhaven Hospital, and I'll say it because to me, this is just a passion project. Don't go to Brookhaven Hospital in Long Island, New York, if you are thinking of tick-borne disease, because they even told her, hey, no, we do doxy for all tick-borne disease. Because then one of the things was, if you have Babesia, then your doxy is not really effective, right? I'm sure you know this, Dr. Gaslin. So tell her that's probably not a good approach. They say, oh, no, we use doxy for everything, even Babesia, which is not correct. She goes home. She brings her mom back to Stony Brook University, which is another local hospital the next day. They run all the tests again. Turns out she has Babesia. They start giving her the proper, CDC recommended protocol, and now she's doing better. But without the knowledge of, hey, Matt annoys everybody about tick bite prevention, and I know a little bit to advocate, these doctors would have put her down the wrong path, and she could have been a disseminated, really serious case. I mean, look, she was very sick, right? But you need this knowledge. Without this knowledge, people's lives can be ruined and destroyed. So that's how powerful the work you're doing is. I mean, that's just one example of, times 10,000 probably this, in the next 2 years that you guys are going to have a positive impact on. So, that's really admirable. And we applaud you and everything you're doing, Dr. Gaslin, over there, and very appreciative for you.
Well, thank you. It's truly our joy and pleasure. And like I said, if you get up every day and love what you get to do, it's just amazing. It's an amazing way to be able to live life and enjoy, what you're doing and the people you get to engage with. And I tell people all the time, I learn as much from the kids as they learn from me. And they teach me about how to live life and how to be present and just how to slow down and just enjoy the moment and know it's okay if we're just playing a goofy game of throwing darts or playing ping pong. And that's just really what life is about sometimes. And we can do that and just enjoy each other in a way that puts technology to the side, and we won't get on a whole nother topic there, but
Mhm.
but we get people to have eye contact, have face-to-face encounters. It's amazing how it can change your life and make a difference many years down the road.
So for anybody listening that has a young one in their lives and they want to help them learn more in a fun way about tick-borne disease prevention, can you just give us an example or maybe two examples of a fun game in detail that you can recommend and describe for us so we can implement these fun learning experiences for young children in our lives?
Yeah, youth are higher risk for tick bites because they're more exploratory, right? They're investigators and they love to learn. And so one of the things we actually love to do is give kids a magnifying glass, and we play games in nature to say, okay, I want you to take your magnifying glass and go find the very smallest thing you can find in the woods. And boy, they love it, especially like your 7 to 9 or 10 year olds. They love to get out, investigate, and they bring it back. And then we have a whole talent show contest about the smallest item and who found the smallest item and what do you think it is. So just a really simple thing. Doesn't require a lot of preparation, doesn't require a lot of time, but it does allow you to give kids the chance to really engage with nature, put their hands in the dirt, touch the leaves, touch different bugs, those kind of things. So that's kind of a fun thing for kids to do. And we'll say, okay, you bring back the smallest thing and you're the one that gets the first popsicle, right? Whatever. So that's a fun way to do. And then obviously other ways are just to kind of do anything visual. Most of us are visual learners. So if you give us pictures, ideas, fun things to look at, we retain that better. As a general rule, there are some great auditory learners, but that's not the majority. About 75% of us are mostly visual learners. Creating some type of visual encounter. So let's just say you want kids to remember the tick education things you taught them before they came to camp that parents discussed with them. Have pictures, right, available throughout the camp that reminds them, oh yeah, we got to tuck our pants and our socks. Oh yeah, before we leave out of our cabin here, there's pictures beside the door that say bug spray, sunscreen, and you do that and you show them pictures of that. So we all get these visual reminders that stick with us. And you can do that even for a gaming approach. If you have pictures of all the prevention strategies for ticks, you have them kind of line it up. If you're going to do a tick, you find a tick on yourself. Let's line up the pictures on what we're going to do to remove the tick. We're going to remove it, and then we're going to wash our hands with soap and water, and then we're going to do this, and then we're going to follow up. And so it's just easy things, right? They don't require a lot of technical thinking, but easy visual stimuli that help people engage with their environment or their experience. So we just like to give kids the opportunity to learn on their own, to become independent learners. And when we do that, they will embrace it time and again because that's what they are. They're investigators and explorers. And if you give them that opportunity and window to do it, they're going to fully engage with you.
Yeah, so clearly, Dr. Gaslin, you couldn't determine what you wanted to be in life because you are a brilliant teacher and also a brilliant doctor. So you just said, I got to figure out a way to do both. And here you are being using both of your God-given skills
Yeah.
to help people heal and manage their health, but also educating people, which is a real talent, right? Especially in today's world where young people are afraid of public speaking or communicating or
Mm.
physical interaction or scary things like being a doctor. So we need more of that to blend it together with, teaching and medicine, never mind combining that with tick-borne illness. So, I mean, what a unique person you are. And, we're just so happy to have you part of this community. I'm realizing now that, we've had you for quite a while. So I do want to wrap that and wind it down and ask if people are listening to this podcast and they want to learn more, what are the best ways to, or what's the best way for them to learn more about you? Is it your website? And if so, what is that website?
Yeah, thank you for that. Our website is Alliance for Camp Health, all one word, all put together, Alliance for Camp Health. And there is all types of education and resources and tools available for tick and Lyme disease prevention. Uh, there's information there about how you can get engaged. Like you read earlier about if you want to learn more about the program, you can just click on the form and input your information and we will get information to you. We are just excited about the opportunity through the partnership with SC Johnson to reach more and more and more people. And so we're forever grateful for them. We're forever grateful for our camp communities across the US who say, we know that serving youth in natural spaces can be life-changing, can change our world. And so we just think it's a powerful way to kind of engage and give back in service to others who maybe need our help. So we're glad to do what we do.
Well, Dr. Gaslin, I can't thank you enough for joining our Tick Bootcamp podcast. We're going to have to certainly talk more offline and try to link you up with all the people we've met so we can continue to grow and push out this knowledge that we so desperately need in the world. And I think next year we got to get you back. We got to give an update next year at the beginning of the season to see where you're at, the influence you're having across the country, and just really give a positive update, because we're all in this together, and we're so happy to have met you and can't thank you enough for joining our podcast.
I would love to come back because we've got more new things in store for next year. So it's exciting, Matt. We got the Tick seal program, so you can achieve a seal that you put on your site that shows that you've accomplished all these educational pieces. So we are moving forward with more opportunities for camps to demonstrate their expertise and engagement with this work. So let's connect. We will do it.